Now, today marks the last day of the United Nations annual 16 Days of Activism Against Gender-Based Violence campaign. Now, the campaign has been running for the past 30 days to draw attention to the scourge of violence against women.
According to the UN, nearly 1 in 3 women have been abused in their lifetime, and in times of crisis, this number rises, as is seen in many countries during the COVID pandemic. Now, in the course of this campaign, the South African Medical Research Council and the South African Alcohol Policy Alliance looked at the link between alcohol and gender-based violence, with focus on Malawi, South Africa, Botswana, and Namibia.
Now, this research, however, revealed that harmful drinking fuels gender-based violence. Now, joining us this morning is researcher Dr. Leane Ramsoomar Hariparsaad from the South African Medical Research Council, who was also involved in the research. Dr. Leane, good morning to you. Welcome to Breakfast Central. Now, tell us why there was a need to undertake this research in the first place.
Good morning, and good morning to your viewers. Thank you for having me. So we undertook the research in response to the high rates of both alcohol use and gender-based violence that faces the region of Africa. And we've seen that harmful alcohol use has been globally recognized now as a driver of gender-based violence. But its role was contested for a long time. And that's mainly due to the perception that alcohol, rather than the perpetrator, would be blamed for perpetrating gender-based violence. But we've seen over the last decade or so that there is increasing evidence that that people who perpetrate gender-based violence have actually reported usually high rates of alcohol. And so I think that we need to recognize that there's a clear link between heavy alcohol use and gender-based violence perpetration. For example, in recent research that we did in a few countries across Africa, we found that men's alcohol use tripled their risk of perpetrating violence against women. And when we spoke to women who have experienced their partners being frequently drunk, they reported more than 6 times being more likely to experience particularly intimate partner violence.
Wow, Dr. Leane. I mean, this research has brought out a lot of evidence. But what do you think can be done to address the link between harmful drinking and gender-based violence in an African context?
So thank you for that question. It's an interesting one because the African context is really a complex context. It's a context that has a history of having been colonized, where there was proliferation of both legal and illegal alcohol outlets. And so it's been really difficult to work in an environment where there is such density of alcohol outlets, as well as rather permissive trading times around alcohol use. And so what we wanted to understand was, how does the issue of alcohol being easily available and accessible to large numbers of people, often through long periods of the day and the night, how does that impact on both alcohol consumption and on its related harms?
All right. Now, Dr. Leane, I mean, with what you've come out to tell us, with the statistics and the evidence that you've given to us, you talked about how men's alcohol use as the effect it has, and how it can go 3 times, cause more effect and damage to the society. Olisa, that's a lot.
Yeah. So, Dr. Leane, these are some of the key findings we're getting from this research. Now, you can tell us more about these key findings, and what do we hope to achieve through this sharing of these findings?
So I think what's really important is, firstly, for us to move beyond the contestation of alcohol's role in gender-based violence. We have seen clearly now, both in the global north as well as emerging evidence from the global south, and particularly on the region, that alcohol does play a role in gender-based violence. It's not causative, but in all the pathways that lead to gender-based violence perpetration and experience, alcohol is consistently present. What we need to be thinking about is, how do we intervene through the various levels at which alcohol's harm plays itself out? And so in the review that we conducted, we really wanted to look at some of the structural factors as I mentioned, alcohol outlet density, which really translates to the number of alcohol outlets per square kilometer, which we see characterizes many of our communities as being very high and very dense. The other thing is around permissive trading times. And what's been interesting in the COVID pandemic is that it gave us an opportunity really to see almost a natural experiment where during the time of the partial or complete bans on the sale of alcohol, certainly in South Africa, we saw that there was an almost 53% decrease in violent trauma, in gunshot wounds, and those kinds of alcohol-related harm that sends people to trauma units. And for a long time, we have not really had an opportunity to see what complete or partial bans have done. And the COVID pandemic, I mean, one of the, if one can call it one of the positive offshoots of it, have seen certainly that structural interventions like making alcohol less available and less accessible can reduce harmful alcohol use as well as its related harms.
Well, well, Dr. Leane, only timely that, this research is coming out. And we have you on the program today to spread the word, because today is a Friday. And we all know what happens
on a
Friday when it comes to alcohol. So if you were to give one advice, one word, as we end, the 16th day of gender-based violence, based on this research out in South Africa, linking alcohol to gender-based violence increase, what would that be from you, doctor?
So I think that, it's important to note that the research actually looked at 4 countries across Africa, which were South Africa, Botswana, Zimbabwe, and Namibia. And so the one thing that has come out quite strongly is that there is a pattern of heavy alcohol use. And as you quite rightly say, we've seen historically that this happens over weekends, and there's almost a stocking up of alcohol and heavy episodic drinking. And by heavy episodic drinking, I mean people drinking 5 or more drinks in one sitting, but more than 60 or more grams of alcohol. And this has really been shown to have negative effects, not just on gender-based violence, but on violence in general, on general kind of disturbances and all sorts of other societal issues. And I think the one bit of advice is really to get people to think about drinking responsibly and understanding the effects of alcohol, not just on themselves, but also on the people around them. And particularly at this time of gender-based violence prevention commemoration, we need to think about the effect that it has on women and on children. The effects have been very clear over the last while, and certainly from the research that we've conducted, that women are at risk because of men's drinking. And even the psychological harms and the emotional harms that are experienced by children needs to be taken into account. So it's really an appeal to everyone, particularly people who work at the level of implementing alcohol policy. I think a call to action would be to really ensure that policies and regulations around making alcohol less available and enabling an environment that allows alcohol to be taken in a responsible way really needs to be considered very seriously.
Wow, Dr. Leane, less available will mean low sales for the alcoholic brands. But well, I hope they're watching, I hope they're listening, and I hope the important stakeholders get involved as well. But thank you so much, Dr. Leane Ramsoomar, Hariparsaad. Thank you. You're a member of the South African Medical Research Council. Such an insightful conversation we just had with you.
And some food for thought too for a Friday going into the weekend, right, Dr. Leane? Thank you once again.
Thank you so much for having me.